I first heard of Southwestern Vermont Medical Center about 6 years ago when I was an employee of Bennington College. My coworkers were speaking about their experience there, specifically within the OB/GYN department, so I decided to look into it and ended up making the switch to those physicians, and I've been there ever since. My first impression was the staff. They were incredibly welcoming. They were nice and helpful, and then obviously the nurses were the same way. My first experience with a physician there was Dr. Small, so I could not have asked for a better, more comforting, nurturing, welcoming physician. I mean, she was so positive and really put me at ease. The birth of my first daughter, Iris, was a whirlwind. The nurses just instilled so much confidence in me, though, so it made me feel very comfortable, even though it was one of the scarier moments of my life, giving birth. I was unaware of what to expect, but they obviously were in control, so that made me feel confident in my ability, and they made us feel comfortable with where we were. The postpartum care was tremendous, and we could not have had a better experience. With our second daughter, Sloan, the pregnancy could not have been any more opposite, not in terms of my experience within the hospital system, just with my health and the baby's health. Sloan measured in the less than 10th percentile our entire pregnancy, so I was on high risk and she was high risk. The doctors and the staff and the nurses all did their best to make sure that we weren't, unnecessarily worried, and were pretty encouraging of us. All in all, it ended up being okay, and she was born perfectly healthy. Thinking about my experience both times, the nurses were empowering, just comes to mind, because they just made me feel like I could do it. Dr. Small is compassionate, nurturing, maternal, encouraging, instills just confidence in her patients. The last office visit I had, they did a stress test where they discovered that my amniotic fluid was quite low. So she gave me a couple options, told me, take your time, go home, speak with your husband, let us know, what we can do to help, make your decision. And I said, who's on call tomorrow? And she said, I am. And I said, okay, I'm gonna do this. I just felt comfortable with her. She knew the situation. She made me feel like she knew my story. She wanted to help. She knew exactly what was happening, and I just felt like that would have been the best scenario for us, and it absolutely was. She was very busy that weekend. I just think the level of care and the quality of the physicians and the staff and the nurses is just unmatched.